This is the skill removing and applying dry dressings. Start with your 6 essential tasks and verifying your orders. Place the patient into a comfortable position that is providing easy access to the wound. Perform hand hygiene and don clean, non-sterile gloves. To remove the dressing, loosen the edges of the tape of the old dressing at an angle parallel to the skin. Hold the edge with one hand and gently raise the edge until it is taut but not pulling on the skin. Push the skin off the tape. You may need to use adhesive remover pads to prevent tearing of fragile skin. Begin at the edges of the dressing and lift the dressing towards the center of the wound. If the dressing sticks, you may moisten normal saline gauze pads to help remove it. Assess the amount and type of drainage present on the soiled dressing, then dispose of the soiled dressing and gloves into a biohazard bag. Remove the cover of a tray of sterile 4x4 gauze, or you can put sterile 4x4 gauze into a sterile tray and moisten it with solution. Don clean, non-sterile gloves. Gather the gauze pad by pulling the four corners up towards the midline, using the center of the gauze pad as a ball to clean the wound. Gently clean the wound, wiping with the sterile moistened gauze from the inner section to the outer section of the wound, cleaning from clean to dirty. Discard the gauze in a biohazard receptacle. Repeat with new gauze pads in each section. Discard gloves and put into a biohazard receptacle. Reassess the wound for size, color of tissue present, amount, and type of exudate, as well as odor. Perform hand hygiene and don non-sterile gloves. Open sterile gauze packages on a clean and dry surface. You might also use an ABD pad as seen in this video. Apply a layer of the dressing over the wound. If heavy drainage is expected, you may need to use more than one layer. Place strips of tape on the ends of the dressing and evenly space them over the remainder of the dressing. You will put tape on all 4 sides of the dressing. Make sure to use strips of tape that are sufficiently long to secure the dressing in place. The type of tape you will use for the dressing will depend on the order, what is available in your facility, and patient preference as well. For example, some patients do not react well to the really sticky forms of tape and might do better with paper forms of tape. Ensure that this dressing is adequately secured. Remove your gloves, turning them inside out, and discard them in a biohazard receptacle. Assist the patient to a comfortable position. Complete your ending 4 tasks.